Welcome to this week's episode of UT Southwestern's What to Know. All eyes will be on Orlando later this month when the NBA tips off a restart to the 2019-2020 season. Joining us today are Dallas Mavericks CEO Cent Marshall and the center for the Dallas Mavericks, Dwight Powell. We'll be discussing the NBA's plans to resume play amid the pandemic and also talking about what all of us in North Texas can be doing to keep ourselves safe in the coming weeks and months. So thank you both for being here. So as a lifelong Mavericks fan, I remember very much the night of March 11th, and I was so impressed by the reaction of Mark Cuban and the Mavericks organization on that evening, prioritizing the health and safety of their fans, the North Texas community, and obviously the Mavericks organization. So tell me what that night was like for you and what the days and that followed that were like for you.
Thanks, Dr. Warner, and it's great to be here. It was somewhat surreal when it actually happened that night. Mark and I had been on a call earlier that day, so we knew that some decisions were going to be made probably within the next 2 or 3 or 4 days, but we didn't expect anything that night. But obviously it happened the way it happened. And one of the main things we had a few priorities. We wanted to make sure everyone was safe. Our fans are safe, players are safe, our staff. And then we wanted to, put people's mind at ease from a financial standpoint. So as you know, we wanted to make sure everybody knew that they were going to get paid because the last thing you need is a financial worry while you're having a public health crisis. And then we huddled our folks the next morning and talked to them and then immediately sent them home. That was before anything was, shut down, before any shelter in place orders. We just wanted to send them home in a compassionate way, a way that didn't cause panic. And then, of course, to make sure that they had all the resources and information they need. We already had a business continuity plan in place, which is something, of course, I advise all organizations to have. And then you just plug in whatever the crisis is. And this time it was COVID. So once we took care of our people, then we tried to identify some of the critical needs of the community because it was clear to us very early on that even though we weren't going to be playing basketball, and we didn't know for how long, but we knew we weren't playing basketball, but we'd be playing the game of life with the community. So we just identified some priorities around children, seniors, food banks, child care for healthcare workers. Dwight was very instrumental in that. Love what he's doing in the community. And local businesses, domestic violence, shelters, child abuse stuff. We just kind of thought through what would be the needs. And so just really tried to step up and take care of them and, take care of all the folks who really needed us at the time.
Well, as one of the recipients of your generosity, the work that Mark Cuban, the Mavs Foundation, and Dwight, you personally did in support of providing funds for childcare for our healthcare workers at UT Southwestern was a real difference maker for us early on. Just like you, our lives were very disrupted as the pandemic began to escalate, and many people were having to do a lot of things quickly without a lot of financial pre-planning. So thank you for your generosity and for all that you both have done for UT Southwestern. So Dwight, first of all, how are you doing since your Achilles injury? And then tell us a little bit about what that night of March 11th was like in your mind.
Again, thank you for having us. Me, physically, I'm doing great. Knock on wood. Everything's been on schedule. March 11th, that night, it was a strange experience to hear that it was going to be shut down. It kind of was an awakening of this kind of being a global situation. Once we kind of realized we were going to be at home for a while and not going to be playing basketball, we, like Sid said, had to think about life and continuing to do what we can as leaders in the community to help out. And some of the things that have already been mentioned, we tried to find ways to help those smaller niches as well that may have gotten a little less focused. So the healthcare workers and the families that needed help and support for the children and domestic violence and all those things that were mentioned were extremely important. But then also reaching out to the kid who's at home and isn't going to be able to go to class and may have a little less motivation to do his schoolwork, or the families that have 6 kids, 5 kids in the household and mom and dad are not trained teachers. It's tough. There's stress on the family, and especially when they may not necessarily be having the checks coming in that they're used to. So whether that's just Zooms or responding to Instagram messages or whatever it is, things that we could try to do to help uplift people around us became even more important. And that helped us as well as far as getting through these kind of strange times.
So, Seth, there's been a lot of uncertainty over the last 3 or 4 months on how this was going to go. Tell us a little bit about how the last 2 or 3 months have gone for the Mavericks and how you've been making decisions about how this might go forward.
It's been, needless to say, just quite emotional over the past few months. Just understanding what's going on in the country with the rising number of fatalities, and then of course we have the civil unrest on top of that. So it has been emotional, but it's also been emotional from the standpoint of just watching our players and our staff just rise to the occasion. So it's been, I would say, emotional, very intentional in terms of being a leader, and then just very revealing about who we are as a community, and our resilience, and frankly our preparedness and our humanity overall. So it's been just a range of emotions, while also really trying to move forward and get the job done.
So, tell us a little bit about how involved you and Mark Cuban have been in the bubble plan. And for those people who don't know what the plan is, could you detail that for us?
Yes, the bubble is ESPN's Wide World of Sports complex. So this is where we're going to resume the NBA season in Orlando. So all 22 teams will be in one place, essentially in the bubble. And so we've been involved from the standpoint of meeting with Commissioner Adam Silver and the league executives via the Board of Governors. My boss is, of course, a governor, and I'm his alternate governor. And so we've had lots of calls just working through issues around safety. I mean, safety is number one. I can't stress that enough. And then the format. And so they got a lot of input from all of us.
So, Dwight, tell us a little bit about how you and the players have adapted your training and your life over the last several months in preparation for this restart.
I think this has been for all of us a very unique experience as far as training and preparation, and now ramping up to a playoff level competition intensity. So I think for the first I would say maybe even month of this whole situation, where we were all kind of unsure of what was going to happen, whether there was going to be a restart or not, how long we were going to be shelter in place, when facilities were going to open. I think that's when guys started to really have to get creative with their physical maintenance and keeping up with their fitness, and skill training was very difficult. It was a lot of push-ups and squats in the hallways of our units, and we had to find creative ways to stay in shape. Thankfully, Mark and the Mavs were able to send us equipment. We were maintaining kind of faith that there was going to be some sort of restart. So I think guys were locked into that, and we're able to hold on to that. And our facility is open, but we're still maintaining social distance. We have only one player per basket. They have their own ball, and only one coach working with them at a time. The coach wears a mask and gloves. We'll have to go through it again as far as adjusting once we get to Orlando. But guys are used to the fact that you got to wear your mask. You got to show up exactly when you're supposed to show up, because we want guys walking into the facility kind of alone. We don't want guys kind of crossing paths unnecessarily. You got to check your temperature when you wake up. You got to check your temperature when you walk in the facility. You got to check your temperature when you walk out of the facility. I think we're washing our hands probably 10 more times than we would have normally, which is a good thing. And hopefully we can continue that. I mean, throughout the rest of our lives. I don't see any issue with that. I think it's important just for good hygiene in general. So maintaining that will be good.
So in the beginning of the pandemic, there was a perception perhaps in some that COVID-19 wasn't as high risk for younger people. Now that we're seeing more younger people with COVID-19 and contracting the infection, how is that perceived by the players, and what are you thinking about in your lives off the court and the way you're conducting yourselves?
For the players that I've spoken with and for our team, I think early on, even though we were being told that it wouldn't necessarily affect us, I think we were still acting as if it would, simply because knowing that I could carry the COVID-19 disease to someone who it could affect, I think was cause enough for us to take action. And maintain social distancing and maintain good hygiene and use PPE when necessary. Now that we've seen more people getting affected from different ages to different predispositions, it really doesn't change much for us simply because we've already been taking the precautions to protect ourselves in an effort to protect our families and the people around us and the staff at the Mavericks and the people that live in our apartment buildings. The last thing you want to hear is that you weren't affected by it, but you carried it to someone who was. So from the very beginning, we've all taken very serious precautions to prevent from being infected.
So with the season about to begin towards the end of the month, how are the players feeling about that? And what's it going to be like to be playing without fans? You guys are used to feeding off the fans. How will that be different?
You guys are excited first and foremost. I think what's we're most excited, surprisingly, is to kind of practice and to get all together finally once we get to Orlando and go through that initial protocol and tests. And once we can get 15 guys in the gym together, that'll be something that we've been missing in our lives for quite some time, and to be able to compete again. And then obviously guys are excited for the playoffs. I think that's something every basketball player dreams of, and that's the whole kind of driving force behind the regular season, is to get a chance to compete for a championship. So I think when the thought of that was not certain at the beginning of this, guys were kind of really worried about it. And now that it's becoming more real and we're more tangible, now that we're in the gym and we're training and we're talking about matchups and film and working on games to come, and it's a real thing, guys are getting really excited. So I don't think we've fully thought too much about the life experience in the bubble, but guys are nervous, of course. Safety is the first and foremost, I think, from both sides, as far as concerns from the league and from players. But I think regardless of what happens around us in the communities, based on the protocols we have in place in the bubble, we'll be as safe as possible. I think everyone's on the same page that it's necessary and it's the right way to do it, and it's going to ensure that we can play through to the very last game of the finals without interruption, hopefully. So that'll be an adjustment, but like I said, I think it's the best option we have, and I think it's gonna go great.
We're all hoping as Dallas Mavericks fans that you're playing all the way till the very end. So we're certainly rooting for that, and then look forward to seeing all of you again. So, Sint, you're a culture expert, and much of your professional life has been spent in addressing culture of organizations. So these are very challenging times, not only with COVID-19, but adding to that the conversation around racial justice and racial inequalities. Tell us a little bit about what you're doing to improve the health and maintain the health of the Mavericks organization.
Dr. Warner, that's a great question. First of all, what we're doing is we're having a lot of conversations, and a lot of courageous conversations, a lot of one-on-one conversations. So communication is key. Really letting people express their feelings and what's going on, allowing people to ask a lot of questions. Some of the conversations have been planned. Some of them have just been impromptu, where we started to talk about one thing and it led to some of these issues that are facing the country right now. As you know, we even hosted a big Courageous Conversation community event. And then what we've been doing all along, even with COVID, is making sure that we have mental health professionals available to our people so that they can just talk quietly with someone about what they're dealing with. We've given our staff mental health days because as a leader, I try to stay close to our folks a lot. And I know Mark is doing the same thing, the Coach Carlisle and Donnie Nelson. We're just talking to our people a lot. And when we get that sense that it's time for a break, we give them a break. We're not playing basketball right now, and so we can give them that break. So really just, also giving people resources, putting tools in their hands so they can read more about the history of race in our country and how to respond to that. So just trying to be there for them.
So Dwight, tell us a little bit about what the players are saying and acting on in terms of these crucial conversations, these courageous conversations, and maybe a little advice to all of us about how we can speak to our children and our friends about how to really truly enable change.
Like Sint said, this is a an important time to realize what's going on, and a spotlight is being shined on things, social, racial injustices, and issues that we have to address. And I think our players have done a great job of having open conversations, and we've had, unfortunately, they're not necessarily in person, but we're having real life conversations about our experiences and our feelings, and what we think needs to happen. And I think it's crucial that we share those thoughts with each other and just get them out. I think the more we understand about each other, first and foremost, and then also about the history of this country, the better we can take steps forward. So I think the first step, as far as speaking to your family or your friends or your children or whatever it may be, is to be as honest as you can, and explain where you're coming from, and trying to understand where you're coming from, and then understand the history of this country. And there needs to be change. There needs to be an evolution in the way that we treat each other. I didn't grow up in this country, obviously, just north of the border, so I still have a lot of things I need to learn, and I'm trying to do my best to do that. But also learning from each other, I think, is equally as important, and sharing our stories.
So, Stent, as the last few weeks have played out, Dallas and Texas are a different environment than what we had hoped for in terms of what we're seeing in terms of the escalation of COVID-19 infections. What advice do you have for people in this era of trying to be absolutely as safe as possible while still continuing to work?
First of all, I think we have to stay informed. So we have to get the data. We have to have it in front of us every day. We have to know what is happening in our area. If we're surging and spiking, we need to know that. What I have told my family and my friends and my employees is that if I love you, because I love you, I am going to do a few things. And it's real simple. I am going to wear a mask. I am going to wash my hands. I am going to keep my distance. And then I'm going to vote. So I told them on a call this morning, those are my 10 words. I actually did a social media post. I think we just have to hold each other accountable, but we have to hold ourselves accountable first. There are some steps you can take to limit the spread. Our medical professionals, you all have been wonderful giving us the information. We are not at a loss for information. If we avail ourselves to it, we know what to do. And just hold each other accountable and keep talking about it.
So, Dwight, we've seen an increase in the number of young adults contracting COVID the last few weeks, particularly in the 20-year-old set. So tell us your advice for them and how to live your life and keep yourself as safe as possible. And what are you doing personally?
I mean, I know it's tough. I think the first thing I would say is think about the community, and think about how much you've gained from this community. Think about, I don't know, the simplest things, to like the beautifully manicured Katy Trail, to like the stoplights, to the things that this community has provided for you, and the safety and the welfare and the comfort and the joys, and pay it back by doing your part to keep everyone else safe.
So, Dwight, what personal advice do you have for everyone in terms of keeping yourself safe?
I think 3 simple things is maintain social distancing, wear your mask, and wash your hands as frequently as possible.
Well, thank you both again for joining us today. And thank you very much for all you're doing to improve the health of our community. And we really are excited about seeing the Mavs on TV again, and having it basketball to watch. And we're looking forward to watching you all the way to the very end when the Mavs win the finals. So best of luck. And again, thanks for being with us today.
And thank you. Thank you for what you're doing every single day. We just can't thank you enough.
You heard today again how important it is for all of us to practice social distancing, frequent hand hygiene, and the importance of wearing a mask. That's particularly important as we headed to the 4th of July holiday weekend. So please not only follow these safe practices yourself, but also think about being a role model for others. Again, thanks for joining us, and stay safe and stay healthy.